Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Chief Medical Officer and Founder, Dr. Thomas Pane. Dr. Pane, we have a question this week that comes from our YouTube channel crowd, and it's about tummy tuck and a tummy tuck that someone just had performed. Basically, it's been 6 weeks since they've had it done. They feel super bloated, and their lower abdomen looks like it used to before the actual procedure and muscle repair. So they're asking if it's okay, or should they be requesting an ultrasound to see if everything's okay. Apparently, the physician is telling him that it's what they've been eating. So, Dr. Pane, what would you recommend in this situation here?
Well, a little tricky because I don't have before and after pictures, so I'm just going to kind of guess at what the person looks like and give you some thoughts at what can typically happen here. So if the person had a real loose abdominal wall, where it was kind of coming way forward, and a lot of intra-abdominal fat, then after the tummy tuck, even with the muscle repair, it can be hard to get it to go all the way flat. And there can be some more roundness. Now, if I see somebody that has that, I'm going to tell them up front that the odds of them getting all the way flat are pretty low. It's going to be flatter. It's going to be better than they started with, but it's not going to be totally flat. We have to be careful because in our field, everyone's going to show you these before and afters that look completely perfect. You don't know how many they took to get to that point that they're showing you. And it's not like there's a huge amount of straightforward honesty in the way these procedures are presented to the public. That is one possibility. So if someone has a lot of intra-abdominal fat, it's not that they're eating a lot or something like that. It's that they have fat around where the organs are, and with that kind of rounded body, a tummy tuck is not going to be able to get you all the way flat unless you get lucky. Every now and then, someone does come up pretty flat. It's just that we don't tell you that that's going to happen because I can't guarantee it's going to happen every time. Alternately, if they had a very thick abdominal wall and a thick pannus, and they took that out, that can actually make them look a little round because now you have swelling under the area where that skin was taken out. And in 6 weeks, most of it should be starting to go down, but it's not going to go down all the way. Now, question about whether an ultrasound is needed or something like that. If that's a request on the patient side, it's probably not going to be very helpful. If the doctor thinks something's going on and they need to have an ultrasound to check what's happening, then yes, that would be done. Typically, a plastic surgeon is not going to order that. Now, there can be strange things happening that shouldn't be completely overlooked. If that belly is looking more full to you than it was before, it may not be directly related to the surgery. Does the person have a history of fibroids? Is there something else going on in the pelvis? In those cases, they may need to be evaluated by another colleague, say an OBGYN or a general surgeon, to make sure something isn't being missed. But if you don't have any real symptoms going on, then it's unlikely to be that kind of problem. So I just mentioned that for completeness' sake. What is probably happening here is a combination of postoperative swelling, and the person probably has the kind of abdomen that has intra-abdominal fat or bowing of the abdominal wall, where complete flatness shouldn't have been expected and hopefully wasn't promised before that operation. So again, without the before and afters, that's the best guess I can make at it from what I'm hearing. But those answers should encompass most of the possible options of what is actually going on here. With the more significant things, like I said, something going on in the pelvis or something, very less likely, but not impossible. So just something to keep in mind. So I hope that answers the question and gives you a direction where to go from here. And hopefully it will get better for you.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to our website, Instagram, Facebook, Twitter, or YouTube channel. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.